We from the Department of Periodontology are going to demonstrate the different brushing techniques which we recommend to our patients in different gum conditions. Before starting with that, let us look at the part of a toothbrush. So a toothbrush consists of a handle and a head. The head has heel, toe and bristles. We recommend the use of a soft or medium hardness toothbrush. Now we shall be demonstrating the various brushing techniques, the first of which is modified bars technique or the circular technique. So this technique is recommended for all adolescents and adults with a healthy gingival condition or after treatment of gingivitis. It helps in removal of plaque from the interdental areas as well as from the different tooth surfaces. In this technique, we shall place the head of a soft brush parallel with the occlusal plane, with the brush head covering 3 teeth beginning at the most distal tooth in the arch. The bristles are placed at the gingival margin, pointing at a 45-degree angle to the long axis of the teeth. Gentle vibratory pressure is exerted using short back and forth motions without dislodging the tips of the bristles. This motion forces the bristle ends into the gingival sulcus area as well as partly into the interproximal embrasures. The pressure should be firm enough to blanch the gums. Followed by sweeping motion. Several strokes are completed in the same position. After that, the brush is lifted and moved to the adjacent teeth, and the process is repeated for the next 3 teeth. The process is continued around the arch, brushing about 3 teeth at a time. Then the same method is used to brush the lingual surfaces. After completing the maxillary arch, the brush is moved to the mandibular arch and brushed in the same organized way to reach all the teeth. For the lingual surfaces of the anterior teeth, it should be turned vertically to press the end of the brush into the gingival sulcus area. Brush the occlusal surfaces 3 teeth at a time by pressing the bristles firmly into the pits and fissures and brushing with several short back and forth strokes. The second technique which we will be demonstrating is the modified Stillman's brushing technique. This technique is indicated in patients with gingival recession as it provides good gingival massage. In this technique, the bristles are placed partly over the cervical portion of the teeth and partly on the adjacent gingiva. This can be achieved when the brush is placed at 45-degree angle apically to the long axis of the teeth and is then activated with 20 short back and forth strokes and is simultaneously moved in coronal direction along the gums and the tooth surface. After this motion, there is a sweeping movement of the bristles in the coronal direction. This technique is offering good gingival massage and interproximal cleaning. Similar technique is followed in the lingual and palatal areas of the teeth. Lingual surfaces of the anterior teeth, it should be turned vertically to press the end of the brush into the gingival sulcus area. The third technique which we will be demonstrating is the Charter's brushing technique. This technique is very useful for patients having fixed prosthodontic or orthodontic appliances and also in patients who have recently undergone periodontal surgery. In this brushing technique, the brush is placed at an angle of 45 degree to the long axis of the teeth. The bristles are directed coronally, that is towards the upper surface of the teeth. After the adaptation of the brush in place, the bristles point away from the gums but towards the interproximal surfaces of the teeth. After placing the bristles at the gingival margin, short back and forth vibratory strokes are given. Similar technique is followed in the lingual and palatal areas of the teeth. Lingual surfaces of the anterior teeth, it should be turned vertically to press the end of the brush into the gingival sulcus area. The bristles of the brush are then placed on the occlusal surfaces of the teeth. Using a slight rotary motion, the pits and fissures are clean. This technique, it is helpful because it efficiently removes plaque and debris from these appliances. Even after periodontal surgeries, this technique gently massages the area of wound healing and promotes healing.